Welcome, everyone, to today's episode of Carefulist, the podcast. I am very happy to introduce you to Myra Katz. She is a personal patient advocate who segued into the caregiving space after many years of being a physician assistant in oncology, hematology, and as a hospitalist. Welcome, Myra.
Thank you so much. It's a pleasure to be here.
I'm so glad that you could share your expertise with us today. So why don't we start at the beginning? Please tell us your caregiving story, how your career led you to what you're doing.
I went to PA school, physician assistant school at George Washington in the medical school many, many years ago. I was one of the first graduates there. And I worked in different areas. And then I finally started working. We moved to Baltimore and I worked as a hospitalist in the community hospital. And from there, I was fortunate enough to be hired by the oncology and hematology department, which was the most important thing I've ever done in my life. Because you work with people who are scared. They're told they've got cancer or they're afraid they have cancer. And you get really involved in their lives and the lives of their families. And it was a very difficult job. I took it home with me. I didn't sleep well at night, but I felt I was making a difference. I worked with an incredible oncologist who really taught me how to give bad news, how to listen, what to do. And it totally changed the way I practice medicine. Interesting, we're still practicing. How I practice medicine and how I related to people. I got very involved in the hospice there because we decided when somebody had stage 4 cancer, eventually that would be their journey. So we took up journeys and did a lot of education and taught people because I knew that when you tell them something, they don't hear it, they forget about it. You tell them something and they're there with newly diagnosed cancer and they forget half the questions because you say something, the PA or the doctor tells them something like you need a test in 2 weeks, and they're thinking 2 weeks. Well, I've got to go on vacation. What do I do? And they miss the next 4 sentences. So I'd always work with my patients on how to call me back and write down things and not be embarrassed to ask questions. So during this period of time, my husband was diagnosed with prostate cancer. And because of what I did, he had the best treatment because I was able to stop the oncologist in the corner, in the hallway, the radiation oncologist, the urologist, and he had the best treatment. We had to fight to get him certain things, but I knew enough to do it.
Yeah.
But I didn't give him enough of what he needed because I was so busy at work. And he's fine now. Unfortunately, did great. But I decided that wasn't too much. So what was I going to do when I grow up? And I knew there was a new profession out there as a board certified patient advocate. And patient advocacy started years ago by a woman and her husband because their daughter had cancer and there was no one to help them. And they did a lot. And then it just evolved. And then finally, I guess about 6 years ago, we became a certified business. And you could become a board certified patient advocate. And lots of people do it now. And I personally think the ones that are the best for certain people are the ones who are medically trained, be it a doctor, be it a PA, be it a nurse practitioner, be it a nurse, are the ones that can really guide you through the healthcare system. But there's lots of different ways you can be an advocate. So I branched out into that, and I worked with people newly diagnosed with cancer who go through the questions. What do they ask? Educate them. So when they went in to see the doctor would say something, for example, about a CAT scan. They'd understand what a CAT scan was, or they would use a word about, if you have breast cancer, hormone treatment. They'd have known that word, so they don't sit there and start ruminating and not hear the next sentence. And then I'd review afterward, after the visit, I would review what went on, and we do the next step, get them second opinions, and walk them through the healthcare system. I've also given talks on how to get through the healthcare system because most people don't know how to make appointments. We call the doctor's office and you get put on hold. And if I can give you one little tidbit, when you call the office, ask someone's name and use it 3 times. Because that way, when you call back to complain or say something, you just say, well, I called. When you call back to complain to the manager, well, I called and I think I spoke with someone. She had a Southern accent. I think she was old. They don't care. They ignore you. As opposed to, I called and Myra told me that I could be seen next Tuesday And if you use, and then you keep saying Myra this, then it sticks, and then Myra knows she's accountable for what
Yeah.
goes wrong. Um, so I started doing that, and then I started working into end of life. Became a death doula, and I've been doing a lot of work on end of life and getting people ready, even young people. Do you have your advance directive? What happens if you fall somewhere and hit your head and you're unconscious? Supposing you're 28 and you're not married, no one can talk for you because your parents can't talk for you. You're not a minor.
Right.
So everybody who is over 18 has to have something because doctors won't listen to the family members unless you've got a form.
Yeah. So can you talk a little bit more about advanced directives and pulsed forms and what the differences are? Um, and just sort of explain to people what that is.
Well, there's advanced directives saying, what do you want to get done? Do you want to get CPR? Do you want to be intubated? Do you want what? If you can't speak, I'm taking it back. If you can't speak for yourself,
Hmm.
what do you want done?
Okay.
And so you have to have that on your advanced directives. And you also need healthcare proxy, who's the healthcare person in charge to make the decisions. Advanced directives are very important because I've been in ICU, and a parent might put down both of my children, like
Mm.
Perry and Michael Katz might write that down. But Michael has an idea and Perry has an idea. You have to have these conversations beforehand so you know what we want you to do. You can't just assume everybody knows what to do. So you need a conversation, and then you could sit down and do your advanced directives. And you don't need a lawyer to do that. You can do it online. It's very easy, but you need to have a conversation with your family members. And
Mm.
there's things called the Conversation Project, will tell you how to do it. But it's so vital, and we don't want to talk about dying, but we're all going to die. We are all
Right.
going to die. We talk about pregnancy. You get pregnant and you go online, you pick the best crib, you pick the best car seat, you pick the best carriage, and you're inundated and you do everything as right as you can. What about death? Do you
Yeah.
know what you want? Do you want, if you're young, even if you're old, where you want to die at home? Do you want to die with music? Do you want to go someplace in the woods? Do you want to have your family with you? What do you want? And we
Yeah.
need to discuss it, and it's so vital. So a pulsed form, it's physicians orders for life-saving treatment, and there's also MOLS form, which is Maryland orders for life-saving treatment. So there's different ones all over the country, but the last four words are usually OLST, and you can look at each
Okay.
state and see what they are. Every state has a different form, and they're really only important if somebody finds you like unconscious, or they don't know what
Mm.
to do, or if you're last stage of life. Like the EMT comes to your house and you're unconscious. And
Uh-huh.
even if you have DNR plaster tattooed across your chest,
Hmm.
if you don't have a pulse form, an EMT will keep you alive. They will do everything in their power to keep you alive.
Okay.
So that's what that form is really important for. And in Maryland, the form is very specific. I think it's a better form than most because it says things like, do you want to be intubated? How long do you want to be intubated? As opposed to advanced directives will say, until it's decided that I can no longer have quality of life or I can't get better. That's really vague.
Yeah.
So you can do, that's why I like to use Maryland forms when I sit down with a client, because they're more specific. How long do you want a feeding tube in? You
Hmm.
put a feeding tube in, they stay in. They're hard to pull out. So if you want one, if your family decides to put in, how long is the longest time you should keep a feeding tube in? Because some people have it put in and think, I'm going to pull it, and that's akin to killing somebody. That's how they feel. So
Hmm.
these are hard things we need to discuss, and we all need to discuss it.
Right. Yeah. Well, and it's common sense, but it is so much better to have it written explicitly from your perspective, because then it takes the onus off the people who are quote unquote just reading the form, right? They know for sure that it is your wish that you do not have a feeding tube at all, or that you have one, but if it's more than a couple of weeks, you don't want that.
Right. As opposed to the vague thing when it's deemed that I can't be cured. Well, that's just too vague.
Yeah, that's up to too much interpretation.
And then there's the guilt. Well, I want mom to be alive to see my son get married. Well, maybe it's not good for mom to be for that to happen.
Right.
So
Yes.
some people want their parents alive because it's selfish, because they
Hmm.
can't bear to be without them, and they need to think about what is good for them. That's why before you even start this, you have to have conversations.
Yeah, absolutely. Um, I spoke with Lisa Paul,
I
who
was
has the
just
death
gonna
deck.
bring I was just gonna bring that up.
So for anybody who missed that episode of Careful the podcast with Lisa, she has this excellent product called the Death Deck, and you can get it at her website. You can get it on our website, but it facilitates these really difficult questions.
The other thing that's good to use is something called the 5 wishes.
Hmm.
And that's
Okay.
been around for a long time. And that is, I think it's more useful for people who have a terminal illness, because like, what do you want when you die? Although we can use it for everybody. What do you
Mhm.
foresee dying like? Do you, and we had, I was a hospice volunteer, a death doula, as I said. And there was one person who had done the 5 wishes, but the family didn't really look at it. And one of my colleagues went over because the family wanted to go up to dinner. He walked in, the room was all boisterous. Mom was in a coma. Room was loud, laughing. They were trying to talk nice stories about mom. Remember this, remember that, which is all well and good, but they want to go to dinner. So they went out to dinner, and he went in and he looked at her 5 wishes, and it said, "I want to die with quiet music in the background in a darkened room." He
Yeah.
turned down the lights. He put on some very calming music, like ocean music or rocks or river or whatever.
Mhm.
5 minutes, she was gone. So
Wow.
the family didn't realize or didn't pay
Yeah.
attention to her wish, how she wanted to die.
Yeah. Yeah. Oh,
And we need to go through these things every year and change things. So, like, and the anniversary of your birthday, and look at your advanced directives and what you've said, or your 5 wishes, because that really
mhm.
spells out things much better. And actually, on my website, I have a thing about the 5 wishes and the most, and that's under catsadvocate.com. I have a lot of blogs in there about dying.
Oh, thank you.
Um,
Yes, please do go read those and fill out those forms. Um, you had mentioned something about, sorry, I'm trying to look at my notes. Oh, a death doula. And you had just spoken about that. Can you talk a little bit more about what a death doula is and does?
there's lots of variations. A death doula is sort of taken like from a birth doula.
Mhm.
There are some people who go to programs in schools, they become a death doula, and they get involved with the family way before, and they might be called in the middle of the night when someone's dying because the family doesn't want to be alone. They may be there for a week, couple weeks beforehand, afterward, to help the family go through paperwork. um, I'm a death doula trained by the hospice, so because did so much death when I worked on oncology, I had a smaller training. But my what I do is I go in. If now here we don't have it, but in Baltimore we had a freestanding hospice, and I'd go in. They say so and so is close to death. We go in the room, turn down the lights, and hold their hand and sit with them while they pass. And hopefully you might be there and have the. It's an honor to see somebody pass. There
Yeah,
was it's hard to describe. It's such a peaceful feeling, because when they're in hospice, they're not uncomfortable. They get morphine, which helps with breathing. Some people have this belief that you go in a hospital, they give you morphine and to kill you. But if you're not going to die, you're not ready to die, it's not going to matter. But
right.
morphine helps breathing. So if your breathing is erratic, it might be help somebody. But
Hmm.
death can be so peaceful and so beautiful.
Yeah. Yeah, and that is a common misconception. Morphine is really to make the person comfortable. It
Mm-hmm.
is not to accelerate the process. It does not accelerate the process.
No, I sat with a woman, and I went in, and she was in terrible distress.
Hmm.
And I was called in as a doula because her daughter couldn't be there. And I called the nurse, and the nurse said, "We're not allowed to give her anything." Oh, and she was still getting IV fluids and tube feedings, and she was actively dying.
Yeah.
So I asked the nurse, and she said, "The daughter insists. I said, well, does she have a morphine order? She said, and this one was clearly having problems breathing and very uncomfortable, agitated. You could just see her facial expressions. She was very agitated, and this is not going to be a peaceful death.
Yeah.
And the nurse said, we can give her morphine, but a very tiny dose, and we have to call the daughter first. I said, isn't she written for morphine? She said, yes, she's written for morphine every hour as needed, but we have to call the daughter, and it's not enough morphine.
Yeah.
Her pastor came in. He was upset, but the daughter was just, didn't get it, wasn't ready. And
Yeah.
it took her 2 days to die. And it was not a good death. It was just because the daughter wasn't ready. And we need to be ready. When someone's going to die, we need to put it all in there and accept it. And
Yeah.
some people believe you're going to a better place.
Hmm.
It's all what you believe, but we can't keep them alive if it's not meant to be.
Right. Yeah. One of my favorite phrases somebody used, and I don't remember who, and I'm sorry, is that we don't get out of this life alive, you
I
know?
have an old patient, not old, younger than me, but I'm saying who I took care of when I was at the community hospital, and she was diagnosed with breast cancer 15 years ago.
Mhm.
11 years ago, it became metastatic. And boy, let me tell you, this woman lived and lived. I think she's still alive. I spoke to her last week, and now she's in hospice, but just went touring, went to Disney World, spent time with her daughter, did all these wonderful things. And she said to me last week, she said, someone told her that we die twice. Once when our soul enters heaven,
Mhm.
and once when people stop talking about us. That's what got.
Yes.
Second one was what got me.
Yeah. Right. And when my mom passed, I obviously it is a momentous thing when someone physically departs. But what I found and continue to find a lot of comfort in is telling stories about her and talking about her. We talk about her all the time. Part of that is just reflexive because it's like, oh, mom would say this, or yeah, and you do your best impression. Or it's my kids are still fairly young, and Alzheimer's is a very long progressive disease, and they did not get to know her as her full self.
Mm-hmm.
So it is also part of our duty, more or less, to help them know their grandmother in telling stories. And it does really help. It keeps them close in a way that, otherwise you just wouldn't have.
It keeps them alive. They lived, and that we all need to know who they were, what they were, and tell stories about
Mhm.
them.
Yeah. Yeah. So, one of the things in our previous conversation that you mentioned is a key thing when you are going to a doctor's visit is having a goal for that visit. And that's one of the things that I know you do as a patient advocate. Can you give some examples of what goals might be or how people can figure out what they want or need out of an appointment?
Sure. We just moved to a new state. We just moved from Baltimore to New Jersey, so we had to find a new internist. And
Hmm.
I know that if I had my old doctor send the records, she was not going to look through it. I was with this guy for 30 years. I probably have 100 pages of notes, and my
Yeah.
husband too. So I took it upon myself to go through the notes. They sent it to
Hmm.
me, and I went through them, and I pulled out the salient points. And I
Hmm.
gave her the notes, including a copy of my immunization record, which everybody needs, and you should all have that. So you need to know when your last tetanus shot was. Did you have an RSV? Did you get your pneumonia shots as you get older? Did you get your
Hmm.
shingles shots? Things like that. So I brought her that. I whittled. I gave her the shot record, the medicine record, um, and I whittled my history down to 2 pages by both myself and my husband. And she
Hmm.
just said to me, thank you. I would never have read those records. I mean, they would have read it, and they're not going to. So plan. What do you want? And I knew too what prescriptions I needed. So I had a list. Say, will you refill this, or do I need to go back to this doctor to get that done? And I knew I
Hmm.
needed a new doctor. So who do you recommend for cardiology? Who do you recommend for this? Where do you go if you have a heart problem? So I had a whole list of questions I wanted her to answer for me. So I went in with my goals, and it was a very productive visit. But most people
Yeah.
just go in and sit there and don't know what to ask.
Hmm.
So you need to think, don't count on the doctor asking, because the medical profession, has their own list of goals. And if you think we don't, I go in a room and I say, okay, Mrs. P is here. She's had breast cancer. She's had 4 treatments. Today I've got to order echo, whatever, echo. I got to order this. I got to order blood. And I've got to make sure she's got refills her medication. She's on this. And I go in, and the average physician takes 19 seconds before interrupting.
Mm.
So we have goals and how long we
Yeah.
can be in a room. So you as a patient need to have goals where you're going to you're going to walk away and say, oh, I forgot to do this. I forgot to do that. And if you can't get all your questions answered, then say, when can I come back? How do you do it? They ask the doctor how long, how do they communicate? They like portals better. They like phone calls better. And
Hmm.
think about the doctor's role too. I mean, they're working for the insurance company. They're really not working for you anymore.
Yeah.
They're working for the insurance company.
Yeah. That's
And
very true.
and I also know, like, I went in when I was sick recently. I had to go to one of those little doc in the boxes, and I
Hmm.
knew that I needed an inhaler, a steroid inhaler. So I went online beforehand to see which one I've Medicare, which is the cheapest one,
Mm.
which would be covered by my insurance.
Yeah.
So when the doctor said, this is what you need, I said, here, here's 2 to choose from. What do you think?
Hmm.
Because otherwise they send it to the pharmacy, and the pharmacy said, oh, that's not on your list. We can't, this is going to cost you $400. You want to be prepared, because the doctor's office cannot make those phone calls. So you have to be responsible. I mean, we said we shouldn't be, because we pay the doctor, but the reality is the doctor doesn't care. They care, but they can't care. The
Right.
one who cares most is you. You need to know when you need your eye appointment, because half the time you don't get reminders anymore.
Hmm.
When you need a mammogram, when you need a DEXA scan, when you need your shots, you need to be up on that. And I think everybody has to have a notebook with everything in it, small little thing, all of your medical history in it, because they're not going to look. They can't.
Yeah. That is so important. And I'm sitting here thinking, I don't have one for myself. I have notes in my phone, but that's only the highlights. It's not a comprehensive thing. So that's certainly a good reminder for me. Um,
There are
Sorry,
some
it looked like you wanted to say
medicines
something.
that, like for cancer, that you might have been
Hmm.
given years ago, and then something called azithromycin, you can only have X amount in your lifetime, and then you get cancer again 30 years later. Do you know what medicine you took the first time? So they can't give it to you again.
Oh, wow.
You need to be, they're not going to be responsible. They just can't do it. They can't go through every record. And you need to know all your specialists, and you can get a patient advocate or somebody to help put your records together and make your life so much easier.
Yeah. So obviously you serve the area where you live. Where would you recommend, or are there criteria? Maybe that's a better question. What criteria should you look for if you are going to go the route of having a patient advocate with you?
It depends what you need. If
Okay.
it's to go to the doctor's office and you've got a complicated illness, you really want one that's medically trained. It's all well and good to say, well, I know a lot because my mother had cancer, but
Hmm.
a medically trained one can interpret medical records. I
Hmm.
don't give medical advice. I never do. I will read up on something and I will educate my client so they know what to ask. But I never
Right.
tell anybody what to do. I don't diagnose, but I can certainly go through medications and say, ask your doctor about why you're on these 2 meds, because they counteract each other.
Mm,
So you've got to be your own advocate. Everybody has to. And then you could hire an advocate for as much or as little as you need.
yeah.
I think people need to understand how to go to hospitals, what to ask,
Right.
and
Yeah.
never be alone in the hospital if you can avoid it. I don't think anybody should be alone.
That's really good advice because
I
there's
mean,
so much information that comes at you. And as the patient, your mind is already reeling, as you said before, on a bunch of different things. And then you miss stuff.
And you don't know what to ask. You just
Yeah.
don't know what to ask. I was with a patient and she was in the hospital and they were getting ready to discharge her. She had a big surgery and they were going to send her home with an opioid, a narcotic.
Mhm.
And I said to the nurse, when did she have her last pill? Because she had an hour drive home. She said she had it at 10 and now it's 1 o'clock. I said, how often does she get it? She said, every 4 hours. I said, would you keep her another hour and give her a dose?
Mhm.
So otherwise, you're going to send her home. She doesn't have her meds and she's going to be chasing her pain. So there are little things that an
Yeah.
advocate can help you with, medically trained advocate can help you with when you're leaving the hospital, these little tricks.
Right. Yeah. And for anybody who's had surgery, that gap when the medicine wears off, and if you don't have more and you can't stay ahead of the pain, then you're playing catch up, and that's not a fun place to be.
No, but I mean, but those are certain things that an advocate. The husband said, "I never would have thought to ask because why would he? He's never been in that position." But
Right.
those are questions you do need to ask, and do need to know. And you
Yeah.
could have an advocate before you go in for surgery. Hire somebody, an advocate who knows
Hmm.
better, and have them give you advice on what to do and what to ask, and
Yeah.
or read about it. Advocates have written books. It's not you don't have to hire an advocate. There's lots of free things online, but don't go
Mhm.
into anything unprepared and think that they're going to take care of you because they just can't. And the mistakes are rampant. And it's oftentimes not their fault. And
Hmm.
because they're just too busy and they don't have the staff.
Yeah. Yeah. That is a whole other ball of wax.
Just take care of yourself is the bottom line and ask the right
Yeah.
questions and bring somebody because hiring an advocate in the long run saves you money.
Mm. Yeah. Absolutely. Um, you had mentioned something when we had our previous conversation about death cafes.
I did one
And
last
this is
night.
it's a term that, I'm starting to see more, and I think people are starting to hear about, and it's very intriguing. So can you explain and dive into what a death cafe is and what the purpose of one would be?
The one who does them the best is Lisa. Unfortunately, Lisa's in California. I wish she wasn't. It's basically people getting together and breaking off into small groups and talking about dying and
Ah,
what they want and their feelings.
mhm.
And it's a very open concept. I mean, I'm trying to get a couple organized here where I just moved to in New Jersey because I think it's so vital. I was on one last night with some organization called Shomer, which is basically talking about when you die and the Jewish way of dying. And
Mhm.
everybody of all walks of life were in this audience. Just what do
Mhm.
you do? What do you want? Where are you ready? And talk about death easily. We need to talk about our loved ones. What happened when they die? Did we do the right things by them? We just have to have it. And I think it's so good to have the cafes. Just a group
Yeah,
of people talking about dying and making it normalized
right.
because we're dying. What do we want to do when we die? Do you want to get buried? Do you want to get cremated? Do you want your ashes going here, one going there?
Mhm.
What do you want?
Yeah, and I think a lot of people think that that is the conversation, or the only conversation that you have is with a funeral director, and either you're pre-planning or you're already in the need space. And maybe that's traditionally what has been done, but that's not the best way to do
It's
it.
worse. It's the worst way. It's the
Yeah.
worst possible way. You need to be having these conversations constantly. I don't mean
Hmm.
constantly, but every 3, 6 months, have the big one and then go on, have some smaller ones who's going to make decisions, who's going to be involved. And the other thing, too, is look around you and say, if I was to die tomorrow, what's going to happen? Is everybody ready? Is anyone ready to take care of everything? Who knows the bills? Who knows where my papers are? Do I, because once you get things in order and you've talked to your family members, your loved ones, you feel much better. You
Hmm.
will feel like this weight will be lifted from you.
Yeah. Yeah. I mean, it's not the same, but it's sort of similar. I'm going through this with my kids with school projects right now. Like, the longer you put it off, the worse you feel about it. If you just break off chunks and do it as you can, when it's done, it's done.
Right.
Yeah.
But we need to just normalize it. Is the bottom line. But
Yes.
death cafes are great. I did a death over dinner last night. That's what it's called. And it was, we just broke off into smaller groups. We had simple questions like, what do you, if you had, were told you were going to die in 30 days, what would you do? If this is your last hour to live, how would you want it to be?
Hmm.
I mean, those are things to think about. And I'm sure, I think Lisa has that in some of her cards. 30 days, what are you going to do? Well, I'm going to sit down and I'm going to write letters to all my loved ones.
Hmm.
And then I'm going to spend time with them. If I have an hour left, I'm not sure. I'd call people I love and say, I love you. I have no regrets. Just,
Hmm.
and that's one thing I think we need is no regrets. If I die tomorrow, I really don't have regrets. I mean, maybe little ones, but nothing major because all the people who I care about know how I feel about them.
Yeah.
And that's the big thing. I'm not having it. There's no anger. There's no fights. Never um, end any argument or walk out the door without saying something nice because you really don't know if this is the
Yeah.
last time you talk to them.
Right. Right. If somebody's interested in excuse me, a death cafe or death over dinner, where where would they go to find that? Are there certain organizations, or is it often affiliated with a religious service?
There's something called Shomer, which is a Jewish service, and I don't know about other ones, but I think if you just Google death cafes, you can
Okay.
find them. But you have to be careful about who's leading it. And do you agree with the, some people believe in their death cafes may be one similar to like a Buddhist type of death, or what kind of
Hmm.
death, but you want to vet for yourself if that's
Yeah.
the group you want to get involved with. Because they've got all different ones and all different people lead them. So you want to be sure it's the right group for you to be
Hmm.
involved with.
Oh, that's really good to know.
And
Is
I've
there
done
any,
one using Lisa's cards because I think they really are phenomenal. The questions are great and make you think
mhm,
about what you want.
yeah. So I was going to ask something else, but you just said something that makes me, I'm going to change direction here a little bit. With those cards and with those types of questions, um, when people are thinking about their answers, what would you recommend? What is the best way to capture what their response is to those questions?
What do you mean capture?
Should they be writing down, like, so there's a card with a question, should they be writing their answer? Should they just be telling somebody?
They can do either way. I mean, I think the death
Okay.
cafes are usually more strangers. I don't think it's
Yeah.
you get a group of people, so I don't think. And you could write down what you say, but I think you need to think about it first and not jump into your answer because you may change what you think, and then they can have something conversation with their family. And you go to the
Yeah.
conversation Google, they can Google the conversation project, which will talk about how they have to have this conversation. But
Hmm.
realize you don't need to go to a lawyer to get advance directives. Some states need them notarized, most don't.
Hmm.
A pulse form and a MOLS form, you have to have a doctor sign that. Um,
Okay.
but you don't have to go to a lawyer for whatever, unless you're already doing your will. But as one lawyer once said to me, unless you're a geriatric or an estate lawyer, they do a lousy job of advance directives
Mm.
because people don't want to listen. I mean, most people don't know what it means to be intubated. Do you know? Or what
Uh,
CPR means? We're going to break your ribs. I mean,
wow. An intubation, please correct me if I'm wrong, that is when they insert something in your airway so that you can continue to breathe,
right.
right? Okay.
And then the family sometimes has to say, take it out. And that's hard to take it out.
Yeah.
So you have to think about, do you want to be intubated? And it depends on your age, what you want, your illness. That's why you need to have these conversations more frequently than not.
Yeah. Right.
And the feeding tube also. I mean, everybody has different attitudes on it. I think that if you know what's going to come out, if you have an illness where they say we're going to put this in because you have head and neck cancer, you can't swallow, you'll be able to eat food for 3 weeks or 6 weeks. That's good. There's an end date, but there's no end date. You really have to think long and hard about, do I want a feeding tube?
Yeah.
And we don't have to feed everybody. We feed them because it makes us feel good.
Right.
So we have to remember where the feeding is because we feel we can do something, but is it the
Yes.
best for them?
Right. And depending on the situation, feeding and hydrating can prolong
Mm-hmm.
the inevitable outcome.
Right.
So somebody whose body would otherwise be ready to die takes that much longer
Right.
because it is continuing to be fed and hydrated.
And death by starvation, basically not eating or drinking, is a very peaceful way to die.
Yeah.
I'm not advocating for everybody, but people make a choice. I don't want to eat or drink. Don't make them. If they have
Mhm.
a terminal illness, don't make them eat or drink. But you need those conversations beforehand to understand it.
Right. Is there anything else that you think people should know or think about that we haven't covered?
I just think that patient advocates are needed now more than ever. It's not just to push me. I think that we don't have enough. If your insurance company offers one, remember, they're working for the insurance company to save them money. They're not working for you.
Oh,
Hiring an
that's good to know.
advocate doesn't have to be that expensive because you may not need them for that long, but the difference they can make in your healthcare is insurmountable.
Mhm.
I mean, they will take all the questions out of everything and make it easier to navigate the healthcare system. And then you could then focus on yourself and your loved ones.
That is really good advice. Thank you. Okay. Well, thank you, Myra Katz, for joining us today and sharing your experience and expertise. And for anyone who is looking for additional information, I know you mentioned your website before, but would you say it for us one more
Sure.
time?
My business is Cat's Patient Advocate, and I'm located in New Jersey, but I go everywhere. I do a lot of Zooms, and my website is catsadvocate.com, katzadvocate.com.
Wonderful. Thank you so much. And to everyone listening, thanks for joining us on this episode of Carefulist the podcast. As always, you can find resources and everything else you need at carefulist.com. Until next time, take care.